This is Chapter 18 out of your Ward and History, Caring for the Normal Newborn. So immediately after delivery, you want to establish an airway. Usually that's done through suction, whether it's nasal or oral suction. You want to take the infant and put the infant underneath a heater and dry the infant off. Put a cap on them and then take them back over to mom so that the infant can lay on mom's chest or on mom's abdomen, and then put some blankets around baby. This will help mom too, because after mom delivers, she'll be shivering. So while you're drying baby off, you're going to observe the respiratory effort, color, muscle tone. By drying, you're going to stimulate the neonate to breathe and cry. You're going to listen to the heart rate, take the temperature, count the number of umbilical cord vessels. There should be 2 arteries and 1 vein. You're going to note any obvious abnormalities. You're going to do your APGAR at 1 minute after birth and then 5 minutes. So the APGAR is scored from 0 to 2, and there's 5 different categories. There's respiratory effort, heart rate, muscle tone, reflex, irritability, and skin color. So the heart rate needs to be between 120 and 160. Look to see, is baby grunting? Do you see nasal flaring? Do you see any problem, like does baby seem to struggle with breathing? Is there retractions in between the ribs? You want to establish identification, whether you're putting on like those hugs bracelets or whatever the hospital permits. Make sure that baby has a wristband on, and mom and dad, or mom and whoever else has some sort of identification. They do some prophylactic treatment. They'll use an erythromycin ointment, is kind of the standard for eye prophylaxis, and they'll put that in just in case baby's contracted something on the way out from the birthing canal. Then they'll do the vitamin K injection, which we've talked about the reasoning behind that, and then a Hep B vaccine. Parental consent is required for the Hep B vaccine. You're going to take baby's blood glucose and hemoglobin and hematocrit, which I talked about before, are going to be high due to polycythemia, so all those extra red blood cells. So later on, after mom and baby have bonded, you want to look at baby's skin color. Is it jaundice? The body positioning. Is baby reacting to the environment? And then you're going to do the Ballard gestational age tool. You're going to take baby's weight, length, head circumference, chest circumference, abdominal circumference, and then do an assessment. So you're going to inspect baby's skin. Again, color, texture, if there's any birthmarks, skin problems, birth injuries. Sometimes baby can have a little bit of swelling or a little bit of bruising from birth injuries. Sometimes post-term infants have kind of a tough leathery skin, so watch for that. Baby can have some mela, which are these little white kind of papules. I'm sure everybody has seen them, up by baby's nose and on cheeks and forehead. Baby can have a yellow pimple-like rash, and that's called erythema toxicum. You want to look for pigmentation abnormalities like Mongolian spots. Those are usually found in races with darker skins, and it almost looks like it could be like a deep brown or like a deep blue purple, and it almost looks kind of like a bruise. The Mongolian spots do fade with age. You're going to look for birthmarks. brown nevi. Those are like just brown marks that are on the skin. Or the nevus flammurs, that's the port wine stain. It's usually like a deep red or deep purple. Tangulectatia is a stork bite, is how that's described. And then the nevus vasculosus, that's like a strawberry mark. You're going to want to assess baby's head, the symmetry, baby's eye shape, size, placement. See if you see a red reflex with the ophthalmoscope. The ears should be the same shape, size. Baby needs a hearing test done. You're going to look at the fontanelles. You're going to estimate the size. It should be full without bulging. If it's bulging, that could be a sign of increased intracranial pressure, and if it's sunken, that can be an indication of dehydration. So the head, caput, the caput succedaneum, that is like an edema that crosses the suture line, and usually it disappears in a few days. It's not really a big deal. But if the baby has a cephalohematoma, that could be more of a serious condition. You'll often see that with jaundice, and that usually persists for weeks. And again, this one does not cross the suture line, whereas the caput, it does cross the suture line. So assessment, you're going to want to look at baby's mouth, look for Epstein pearls. These are these little hard white nodules that are usually on the roof of baby's mouth. You're going to want to test their ability to suck. You're going to look for any abnormalities with their hard and soft palate, like cleft palate. You're going to look at their neck for totocolus. This is a deviation of the neck on one side, and that's due to like muscle contractions and spasms, but this needs to be reported immediately because it could be a cervical spine defect. You're going to assess the respiratory system, making sure that chest movement is symmetrical, nasal patency, the respiratory rate pattern, if baby's using accessory muscles. You're going to listen to the lungs, and observe for breast tissue, because if baby has a lot of breast tissue, they could have that'll be documented as wide spaced nipples, and we often see these in babies with Down syndrome. Again, skin color, cap refill, we talked about it needs to be 3 or less. Some signs of distress, if baby has nasal flaring, grunting, retractions, that could be an indication that baby can't breathe. The cardiovascular, you want to listen to heart rate, do the cap refill, feel the peripheral pulses. You want to listen to all heart sounds to see if you can detect any murmurs. GI system, again, you want to look at that umbilical cord. I mentioned 2 arteries and 1 vein, AVA. You want to listen to bowel sounds, look for any abdominal distension, or if there's an absence of bowel sounds, that could be like a life-threatening emergency. You want to look to see if there's discharge from the cord site, or if there's any hernias or abdominal masses. The GI system, you want to look at, palpate and inspect the scrotum, testes, penis. With the male, you want to retract their foreskin. Look at the female genitalia. In males, scrotal swelling is pretty common. They can have that smegma, which is kind of that whitish, it's kind of almost like cottage cheesy like, and oftentimes you'll see that around like the foreskin. They can have hypospadias or epispadias, where the urethral opening is not in the correct place. So for females, Oftentimes there can be tags on the hymen or Birthmarks on the labia, and that's again kind of a white cottage cheesy color. Or pseudomenstruation, that's where the baby girl will have a little bit of blood. But some conditions to be worried about is going to be some conditions to worry about will be like undescended testicles, a micropenis, and this is if the penis is smaller than 2 centimeters. Ambiguous genitalia, and that's when you can't really tell if it's a boy or a girl. Imperforate hymen, that's where the tissue is swollen or there's a growth of tissue that obstructs the vaginal opening. Or there is imperforate anus, and that's the absence of an anal opening. Musculoskeletal assessment. You want to observe for the infant's movement in the crib. Make sure that do some gentle passive range of motion to make sure that all the joints rotate right. You want to assess the for head leg. Look at the skin folds on the thighs. Again, watching for that torticollis, and then looking for any hip dysplasia. So that would be like if there's some asymmetry of the hip folds, if you can feel that crepitus when you're moving, if the foot's positioned in kind of an irregular way. You're gonna look for fractured clavicle, which if sometimes physicians have to fracture that clavicle to get baby out. You're going to look for polydactyly, where there's extra fingers or toes. The syndactyly, where there's webbing in between the fingers or toes. And then that simian crease, that's something we see in Downs. It's when you look at baby's palm, we're supposed to have all sorts of creases on our palm, and if baby only has one single crease in the middle of the palm, that could indicate Downs, or we see them more in Downs babies. You're going to look for the reflexes, the gag reflex, Babinski, Moro, Galat. The Babinski one is where you stroke up the side of the foot, and babies should pull in their toes and then extend their toes out and kind of stretch them out. The minor, you want to look for the palmar grass, plantar grass, if they're sucking, and then again that neck reflex. So some conditions that warrant further assessment: look for shoulder dystocia, Erb's palsy. You'll see like baby will have their arms and legs extended, but if they have that Erb's palsy, they can't move into the flexed position. Look for cerebral palsy, spina bifida. You want to teach mom and dad about newborn care, so you want to make sure that baby is nice and warm, but not too warm. Bathing. You want to make sure that mom and dad are bathing in a little neonate tub with about 4 to 5 inches of water. Kind of submerge baby, and start with baby's head. So you can get baby's head all clean and then dried, and then put a cap on so baby doesn't lose a whole lot of heat. Making sure they're cutting the nails and doing umbilical cord care. So the cord needs to be dried, so the diaper should be folded down below the cord. And making sure you tell mom and dad in about 10 to 14 days the cord will fall out. So when the cord is not on baby, it's okay, it's falling out, and that's normal. Making sure that you tell mom and dad to change baby's diaper every time they urinate or defecate. For the babies who are going to be having cloth diapers, making sure that mom and dad know that they need to soak the diapers and then wash them separately from all the rest of the clothes. You want to make sure mom and dad get a good bonding and attachment with baby. Circumcision is optional, but if they decide to do circumcision, watching for signs of infection, making sure that baby has optimal nutrition, whether they go breastfeeding route or formula feeding. And then teaching mom and dad about the newborn screening tests. There's several of them. Some examples are like testing for CF, PKU, sickle cell anemia.